The Billings ovulation method actually has a very long, successful history, which began with John and Evelyn Billings. They were both doctors. Dr. John was a neurologist, and he made the connection between a woman's hormones and her natural indicators of fertility, which can reliably be used by couples according to their intentions. Now, BOMA USA is the affiliate of the Billings ovulation method here in the United States. The Billings method is actually worldwide. The international organization is WOMB International. Each affiliate will use their materials to allow us to teach the official, authentic Billings ovulation method within our geographical area. Now, BOMA's mission is to offer the most simple, the most personalized care in fertility education, and we want to make this knowledge accessible to women and couples.
The woman needs nothing more than herself to make the observations. She needs no extra gadgets or devices. She'll be taught how to make her observations as she goes about the normal course of her day. Let's face it, everybody's busy. And so I think this is one aspect of the method that that we get the feedback on, that about how wonderfully simple it is to make these observations. In other words, we're going to teach you how to tune into the sensation at the vulva as you go about the course of your day, and then take a note of anything you happen to see when you're in the restroom. But you don't have to you don't have to touch or examine or anything that we are asking you to not do anything different than what you've already always done. We're just going to teach you how to be aware. And the second part of that is to record with the correct stamp at the end of the day and make a little notation on the chart. And that's it.
The Billings method is very effective in helping couples both avoid, achieve, and I get excited because it even alerts them to medical conditions that they might need to have investigated. Now, for avoiding, it's over 99% effective when they use it according to our method guidelines. Couples that are wanting to use it for achieve, it's wonderful. We hear back from them that they are achieving pregnancy faster when they know how to target their fertility. Did you know that even couples who have been thought to be infertile or who have had failed attempts at IVF, they are having encouraging success once they know how to identify their fertile time and how to look for their peak of fertility, which we know when they do that, it's going to optimize their chances of achieving. Now, if somebody wants to know more about the studies that go into this, we would direct them to the Billings Life website. There's a ton of information. It's a great place to go just to learn a little bit more.
The very best way is to learn with a certified teacher, and to find one, you'll go to the boma-usa.org website, look under the drop down for Learn the Method, and then find a teacher in your area. If you don't have a teacher in your area, we also have an option for remote learning, so you can find a remote teacher. That first session is going to take about an hour or so, and then a follow-up is scheduled 2 weeks later. We'll keep scheduling follow-up as long as the couple or the individual needs in order to achieve a level of confidence and to be able to have a knowledge of how to apply the rules for the objective that they want to reach. And I think one of the things that we really do enjoy doing is working with people together that are learning together to learn how to work as a team.
I really think that what makes the Billings ovulation method unique is the way that we have the personal approach with the women, and we treat them individually. We don't ask women to fit into some type of one-size-fits-all box. We recognize that each woman has a unique pattern of fertility, and we're going to work with her to figure out how that works within her normal phases of her cycle and for her individual objectives. Now, we use 4 simple guidelines that have objective criteria. And we are so proud of our 850 hormonal essays that added to our foundation, where women track their cycles and their individual charts, which really, well, we like how that added to our foundation. Now, The four simple rules and guidelines can be used for every single thing that the woman's body is going to throw at it, whether she has normal cycles, whether she's going through stress or breastfeeding, or even navigating menopause. She can even have irregular cycles that are requiring medical care that are going to be alerted, like PCOS and other conditions, which these guidelines also handle. Our focus and the foundation with the hormones have really made the method able to handle all the situations that a woman will experience throughout her entire life. The knowledge is going to be hers for her lifetime.
I think the strategies that we are using are coming from client feedback. So people want to chart online or with an app, and that's very natural because a lot of people are very used to that. But what is important is that they're charting accurately, and that's what we always stress. So we have 3 approved charting apps or online charting systems that are approved by Womb International. These will not interpret the chart. We're going to work with the woman or the couple and teach them how to interpret their chart. But this is going to take the place of paper stamps and stickers. And so I think that that's one of the things that are that we've done quite successfully. In fact, on with one of the applications, you can when you're meeting with your teacher, we can actually help draw the hormone choreography on her own chart so she can see it. So that's pretty cool. The other thing I think that we have is it's natural for people who are learning to the Billings ovulation method to eventually want to become a certified teacher. So we are meeting that need we have in-person teacher trainings, but we also have a correspondence course where you can learn in the comfort of your home and a solid curriculum that's web-based, and you can meet with your trainer and work through that curriculum on an individual basis. So I think that's pretty exciting for us.